Hello, my name is Lucia Ceballos, and today we are going to talk about Mitotane for 21 hydroxylate deficiency in infertile men. Definition. The 21 hydroxylate deficiency causes defective conversion of adrenal precursors to corticols and, in some cases, aldosterone, sometimes leading to severe hyponatremia and hyperkalemia. The accumulated precursors of hormones are divided in production and androgen and causes virilization.
Hydroxylase deficiency is portrayed in the scene by the hydras playing blackjack, or 21. This enzyme catalyzes the hydroxylation of 17-hydroxyprogesterone to 11-deoxycortisol in the glucocorticoid pathway. Deficiency of this enzyme causes a decrease in cortisol, shown by the court judge with the sun on the downward sloping side of the table, and buildup of 17-hydroxyprogesterone, represented by the hydrogester on the 17 stilts on the elevated side of the table. This enzyme also catalyzes the hydroxylation of progesterone to 11-deoxycorticosterone in the mineralocorticoid pathway. Deficiency of this enzyme causes a loss of aldosterone, illustrated with the aldo and sterol stereo, who is also sitting on the downward sloping side of the table. Because aldosterone stimulates the conservation of sodium and increased water retention, loss of aldosterone causes severe hypotension, the hippo with blood pressure cuff. Volume depletion causes a compensatory increase in renin, hence the wrenches being juggled by the jester. Loss of aldosterone also causes hyperkalemia, shown by the hiker hiking on the pile of bananas. Buildup of 17-hydroxyprogesterone causes the substrate to be diverted to the synthesis of androgens, leading to masculinization. This can present as pseudohermaphroditism in females, represented by the masculine female on the queen card. To sum it up, 21-hydroxylase deficiency leads to decreased cortisol, increased 17-hydroxyprogesterone, and decreased aldosterone, which can then cause severe hypotension.
Mitotane. The mitotane, sold under the brand name as Lysodren, it is an exogenesis inhibitor and cytostatic antineoplastic medication, which is used in the treatment of adrenocortical carcinoma and Cushing's syndrome. Applications in medicine. The mitotane is a type of chemotherapy used to treat cancer of the adrenal gland. It works by slowing or stopping the growth of adrenal cortical cells. It also decreases the production of corticosteroid hormones produced in the adrenal gland. These hormones help regulate important bodily functions. Patients will need corticosteroid replacement therapy with fluorocortisone and hydrocortisone.
In adjuvant therapy. Adjuvant therapy means we have removed the tumor in its entirety after surgery, but we want to still give therapy to catch any tiny tumor cells that might have escaped the surgery and that are circulating in the blood. And secondly, we use mitotane in the treatment of advanced ACC, so where the tumor has come back in different locations or in the same location.
It's an oral form of chemotherapy. It's not typical for what we think of when we think about chemotherapy, getting medication intravenously. It's a tablet. Patients have levels measured every month initially, and then once their levels are stable, they will have that blood test done less frequently. We have a particular target therapeutic window for mitotane, so we want to have patient levels in a range that we know will exert the best effect on the tumor. But equally, we don't want to overshoot that because then patients can get side effects from the medication. It has some endocrine or hormonal side effects, so patients who take mitotane will always take hydrocortisone, which is steroid replacement, because remember, mitotane knocks out the adrenal cells, and if you have a healthy adrenal gland left behind, its function will be knocked out or suppressed by mitotane. So they have to take hydrocortisone to prevent them having an adrenal crisis.
Pros and cons. The pros, the Mitotane is used as symptomatic treatment of advanced carcinoma of the adrenal cortex, adrenocortical, unresectable, metastatic, or recurrent. Used also in 21-hydroxylate deficiency and azoospermia. Cons, possible side effects like nausea, vomiting, changes in mood or behavior, hypertension, hypotension, changes in electrolytes, gynecomastia, confusion, and rash. These symptoms are generally related to the higher level of drug in the blood. Therapy will be continued until symptoms improve and a lower dosage will be continued.
So Mitotane is a drug that we use to treat adrenal cancer. It is an oral form of medication. It's not considered chemotherapy. Some of the side effects that they can have are, and the things that we worry about the most are when they start having slurred speech, concentration issues, where they're having an unbalanced walking, gait kind of thing. So that is number one. If they have those types of issues, we want them to contact the physician. A lot of patients also have nausea and or vomiting, so we want to know if their nausea or vomiting is not controlled by any nausea medications that they receive. They also can get diarrhea, and so we would like them to contact us if they have more than 6 loose stools a day. The other thing is fatigue, and that is somewhat subjective, and so it's what can they handle, and if they have fatigue that they can't handle, we want them to contact us.
Issues applied in Ecuador. In Ecuador, the Mitotane is used like a pharmacological therapy for Cushing syndrome and used as an inhibitor estrogenesis, mostly used in adrenal carcinoma. Conclusions. The Mitotane can be used as a last resort in men with 21-hydroxylate deficiency and azoospermia, in one there is no response to intensified glucocorticoid treatment, or in one azoospermia is associated with large testicle adrenal rest tumors, which impede the testicular surgery that might otherwise improve infertility. Thank you.